Are you having trouble reading road signs? Maybe it's tough to see what's on a menu at a restaurant. Perhaps contacts or glasses aren't for you. It may be time to consider Lasik. Dr. Motwani from the Motwani Lasik Institute is here, along with his patient, Joseph. Gentlemen, thanks for coming in. We certainly do appreciate it.
Of course.
We sort of made light for a moment there of people that may have vision problems, not being able to read a menu at a restaurant. Joseph, your situation was much more dire than this. We were just chatting off camera for a moment. Technically, you were legally blind. Is that right?
It was.
Tell me about life before Lasik for you.
It was frustrating. I could barely wear contacts. It was painful. The day that I walked into Dr. Motwani's office, I wasn't even wearing them. I had to take them out in the parking lot before I walked up into his office because it was still so painful. I just couldn't do it. Couldn't.
Something you were dealing with ever since you were a little boy,
Yeah.
as long as you can remember.
As long as I can remember.
Well, so tell me, you said that you had to drive in an emergency situation once or twice with no glasses and no contacts. You could not see anything virtually.
It was the worst thing in the world. The lights are as big as you can imagine, and I'm just looking down at the side, just trying to stay in line with the line and be safe, and I wouldn't recommend it.
And you said that you went to multiple doctors who told you that Lasik was not an option for you.
Right.
Dr. Motwani said it is an option for you. I'll have you step in here, Dr. Motwani. What was the difference in seeing him and knowing that you could help him? You could make the difference.
You know, he was just asking me the same question. And I was one of those people that are very high prescription myself. So for years, I worked on procedures for treating people with pretty high prescriptions. And so the technology I use also really is set up for that. And so it's just kind of, it's my world. I treat these complex cases. He was actually not that big a deal for me.
Not that big a deal for you.
And so, you know, we use the Wavelight Allegretta 400 on him. He was able to see very quickly by the next day, and he's been stable 6 months. And I assume he will stay stable for years and years and years and years for indefinite.
Joseph, what was it like right after the procedure is over, the week after the procedure is over? Give me an idea of what you were experiencing.
It's hard to put into words. It was just the most relieving feeling, like I had this massive burden taken off my shoulders, and I was in disbelief. I would go to my normal regimen in the morning. I would go wake up, I would look for my contacts case, and I'm like, wait a minute, I don't need that anymore. I was able to get rid of everything that I relied on, and then waking up in the middle of the night, even being able to see the clock clearly, I had all these like red alerts going off in my head. Oh, I slept in my contacts. Oh no. But then I realized I was fine.
This is the new you.
This is the new me.
How's life changed for you, Joseph?
It's been great. It took me a little while to really feel comfortable opening my eyes underwater, swimming, something that I love to do. And that's something I came in afterwards saying, can I really go underwater and open my eyes? And he's like, yeah, no problem. And so it was great.
Well, congratulations to you for essentially getting your life back, because I cannot imagine what you were going through before. Dr. Motwani, if there's somebody out there who may be in a similar situation as Joseph, or maybe not as extreme as him, what makes somebody a good candidate for Lasik?
It all depends on the factors of what their prescription is, what the shape of the cornea is, and the corneal thickness is. And then, of course, it depends on the doctor and what they can do and the technology they have. And what ends up happening sometimes is people think they aren't good candidates. They've been told they haven't been good candidates. And technology has progressed, and techniques have changed over the years, and some patients just think they're not good candidates for whatever reason. We can treat high myopia, high astigmatism. For some reason, people think astigmatism can't be treated. I've treated some of the highest astigmatism out there. And people do beautifully with it. We treat high hyperopia, farsightedness. We help with reading glasses. You know, I'm one of those people, I don't use reading glasses anymore.
Yeah, exactly. I want to let folks out there know about a deal you're offering right now. This is exclusive. 50% off a Lasik procedure for the first 7 callers. The number is right there on your screen, the website as well if you'd like some more information. But again, only for the first 7 callers, 50% off a Lasik procedure. Dr. Motwani, reading some notes on you, I'm told that you are the doctor of even the doctors. The doctors go to you in order to get procedures, the sports heroes, the firefighters, the police officers.
Yeah, we've done a lot of, I've done 100-something doctors over the years. I've done a lot of police officers, firefighters. Actually, that's been an honor of mine to do. We've done a bunch of sports people over the years, too. That's always fun. I'm most proud of the doctors, because I figure if my colleagues will come to me, boy, that means a lot to me.
It sounds like it, absolutely.
Yeah.
Okay, and again, that offer, the first 7 callers right now, 50% off a Lasik procedure. The number's at the bottom of your screen. Joseph, last question for you. For people out there that may be listening to this and sympathizing with you, maybe are in the same position that you once were. What do you say to them as far as alleviating some concerns or fear?
Don't be afraid. I always have that fearless leader type of mentality and type of responsibility, it feels like. But walking into the office for the first time, or every single time that I ever had a Lasik consult, I was afraid. I am very finicky when it comes to my vision, and I don't know what it would be like to go without. So don't be afraid. It's not a big deal. The surgery, it doesn't take very long at all. I laid down and sat up, and it didn't seem like any time had passed at all. So don't be afraid. Just relax.
Get your life back. You sure did.
Get your life back.
Congratulations to you for that. Dr. Motwani, thank you for what you're doing
Pleasure.
for folks like Joseph and other people in our community. Again, all the information is on our website. Go to san diego6.com and click on San Diego Living.